One.
Well, today we have Dr. Amani and Dr. Ishfaq. They both are working and practicing in Oman. We're going to be talking about kidney stone management because it's a very important and prominent topic these days. Very welcome.
Thank you.
Thank you.
So the very first question is going to be for Dr. Ishfaq. Is why do you think the number of cases when it comes to kidney stones are on a higher rise these days?
Actually, it is not on the higher rise. Rather, kidney stone is the number one disease in the urology. The only thing is that we are now patients have become heavier and they are going to the hospitals, getting their ultrasound done. So we are detecting more and more number of cases. Earlier, they were not getting diagnosed. So that's the reason we are getting more number of the patients.
Anything would you like to add? What could be the reason of the increasing number of cases these days?
I'm agreeing with his talk. Yeah, it's because of increasing detecting the cases nowadays, not like before.
Well, next question is going to be for you. Well, if you could recall any of the most challenging cases of your practice wherein you have dealt with such kind of patient who delayed the consultation and how you dealt with that patient.
I think it's staghorn, bilateral staghorn.
Yes.
It's just, sometimes it will become incidental finding, and that will cause delaying in the management.
Yeah.
So actually, I would like to add.
Yes.
Yeah, we have a lot of patients which actually have lost their kidneys. They have lost, damaged their kidneys completely because of the delay in the treatment, and they are not reaching to the doctor, or they are being treated by the people who actually are not expert in the field, and they just manage them for the pain, and they are giving the treatments which actually are not specific for such bigger stones, and they come very late to us. And second thing, complications of infection, they come with the infected kidneys. So these are something which people come late to us.
Well, in your experience, what precaution a patient can effectively take in order to avoid the stones and of course the recurrent kidney stones?
Yeah, a very important question. Actually, stone disease is very common, that's one. Second thing, yes, recurrence is also very common. Around 60% of the people, they again form the stone if they are not heavier, what precautions they should take. So, because the most common stone is the calcium oxalate stone. So, what implies for those stones, we'll talk on that. The one thing which is very important is the hydration, water intake or fluid intake. So we recommend to the patients to form a urine of around 2 to 2.5 liters should be the urine output for 24 hours. So for that, depending upon the weather conditions where they are living, they should take that amount of the water. And this water intake should be round the clock. It's not that in the morning they will take 1 or 2 liters of water in the evening. That doesn't work. It should be round the clock. Rather, I advise to the patients to take a glass of water every hour. That's one. Second thing is we have to encourage them to take more of the citrus food like lemon. A lemon glass of water in the morning and evening helps them to prevent as well as treat the stones. Take the orange, so they are rich in the citrate. At the same time, we tell them to reduce their oxalate containing foods like non-veg, mutton, chicken, and dals and dry fruits, coffee. They all have high content of the oxalate, so they should take it less. And one more factor which is responsible for the stone formation is the deficiency of vitamin D and calcium deficiencies. So that also leads to the stone formation. So we encourage the people. We encourage them to have a course of vitamin D and calcium in between. These are very common things, very important things, and in addition, salt intake should be reduced. So increase more of the salt, increase the stone formation.
Even sugar intake,
Yeah.
They should reduce it.
Okay. Well, any misconception you would like to break here? Because there are patients who comes with misconception or myths.
Very common, very common. Myths and misconceptions because quacks have created this in the patients. And that is the reason that I earlier told you. Patients come once they have lost their kidney. So size of the stone is very important. Any stone more than 1 centimeter, it will not pass whatsoever treatment they will take from here and there. So they need a treatment for any stone more than 1 centimeter. So here the people go on going to the kayaks and getting the treatments done till they lose their kidney. So whenever there is stone, they should consult the urologist. They should not go here and there, and they should be aware of this. That size is very important, and no treatment is there which will reduce the size of the stone or stone will disappear. They are being told that stones will disappear when they will give the treatment. It never happens. Stone will either pass out or it will stay there in the kidney. So smaller stones, less than 5 mm stones, 6 mm stones, or less than that, they pass out. the bigger stones should be treated, and there are different modalities of treatment which are available for that.
Well, what according to you is going to be the next biggest breakthrough when it comes to kidney stone domain?
Breakthrough we already had there. We have all the minimally invasive treatments available for the kidney. So earlier we used to make an open surgery for the stone. Right now, no open surgery is valid for this kidney stones. Rather, it is over treatment and it is brucery if we do the open surgery for the stones. So we have we have lasers available, we have endoscopic surgeries available, we have lithotripsy available. They all patient gets treated, next day they go home.
Right.
So that is already there. We are at the, I think, top of the technology in the management of the stone disease for the patients.
Anything would you like to add, ma'am?
No, I think he said almost everything.
So anything which I might have missed and you would like the
Yeah.
patient to know?
I think again I will tell that this is the advice to the patients that kidney stone disease is a treatable disease, number one. Number two, it's a recurrent disease. That is not that once treated, once they go to the hospital, get treated and they will not form the stone again. They can form the stone again. So they should consult the proper doctor for the treatment of stones, and once it's treated, they should continue the prophylaxis, rather the preventive measures throughout their life.
Right.
Because those kidneys which form the stone, they are notorious for forming the stone again. So this is the advice, that consult the urologist, don't go here and there, and follow the preventive measures and get the proper treatment for the stone.
Thank you so much, doctors. We are very glad to have you.
Thank you very much.
Thank you for your valuable insights. Thank you.